Hi, I'm Dr. Sherry Berger here with this week's Holohan's Hot Topic. I'm with Dr. Melissa Holohan. What's buzzing, doctor, in the world of small animal emergency and critical care?
Well, this week, Sherry, we're looking at feline secondary spontaneous pneumothorax. This was a very nicely done retrospective study looking at 16 cats with spontaneous pneumothorax. So obviously this isn't a clinical disease that we see very often, and so there's not a lot known about the underlying causes of pneumothorax, particularly spontaneous pneumothorax in cats. Primary spontaneous pneumothorax has not been documented to date in cats, and to date, the current literature really only states isolated case reports and case series describing a single underlying etiology, such as a cancerous process leading to secondary spontaneous pneumothorax. So there really hasn't been a good study looking at a large population of cats over time and what their underlying diseases were. So the objective of this study was to look at these cats based on demographics, their clinical characteristics, diagnostic findings, and also trying to determine if those diagnostic findings could lead us to an underlying etiology. And then this was the first report really looking at overall treatment outcome and survival. So they looked at a second objective, specifically looking at the clinical feature differences between cats with asthma-associated secondary spontaneous pneumothorax versus non-asthma-associated spontaneous pneumothorax to see if there was any differences between these two groups. There were 16 client-owned cats found in this study, all of which were diagnosed with secondary spontaneous pneumothorax. Because this was a retrospective case series, there were no interventions. And the overall results were that the most common predominant breed was the domestic short hair. The median age was approximately 8 years, and there was no predilection between males or females. Multilobar pulmonary pathology was found in 14 of the 16 cats. The most common categories in this study were infectious diseases, inflammatory, that being asthma, and neoplastic. And asthma actually came up as the most common cause of spontaneous pneumothorax in 25% of these cats. 10 of the 12 cats treated survived to discharge, including all 4 of the cats with asthma. There were reoccurrences in 4 of those 12 cats, so there was about a 33% reoccurrence rate. Pulmonary lobectomy was curative for 1 cat. This cat ended up having congenital accessory lung lobe emphysema, and we were not able to find in this study that there was no difference between clinical presentation between cats with asthma and cats with non-associated asthma, spontaneous pneumothorax, which I think as clinicians would be important for us to know, as obviously cats with asthma are going to have a better clinical outcome and prognosis overall. So conclusions with this study were that cats with spontaneous pneumothorax frequently was associated with extensive pulmonary pathology, supportive medical management, and in this case that was supportive care or chest tubes, is an appropriate treatment option, except with rare cases where there may be a focal congenital abnormality where surgery is obviously going to be indicated. And asthma-associated secondary spontaneous pneumothorax appears to carry a good prognosis for short-term survival, and this was survival to discharge in this population. However, this study did go on to note that there were no parameters that we could find based on history, clinical presentation, to associate or differentiate between asthma and non-asthma. So we're still going to need to, as clinicians, do additional imaging and potentially invasive diagnostics such as CT scans to differentiate those two diseases. So I thought the main take home from this study was that these cats had a overall very good prognosis depending on their etiology for spontaneous pneumothorax. And so I think some of us as clinicians may see cats with spontaneous pneumothorax and think this is a death sentence for them, when in reality a large portion of them may be asthma associated, and if we can just get them past the initial stages, their prognosis for survival is good. And that's this week on Holohan's Hot Topics in Critical Care.